Okay. All right. Thank you everyone for joining us today. The title of our press briefing today, Redefining Wages for CNAs and LPNs at the Residential Healthcare Facility. Before moving forward, there are some individuals I would like to thank. This day would not be possible without the support and work of many people. I would like to recognize and acknowledge our partners at CSEA. They are our bargaining unit. Specifically, Ms. Brenda Hardwood, who's the Labor Relations Specialist, Ms. Heather Foster, our unit president, and Heather is able to join us this afternoon, and Ms. Julie Hanno, our unit steward. Additionally, I would like to acknowledge the support of the Lewis County Health System Board of Managers, the board's Human Resources Committee chaired by Ms. Jenny Jones, and the board's Executive Committee chaired by Mr. Michael Young. And lastly, I would like to acknowledge and thank Jessica Skiff from the Human Resources Director for the health system. We have been working on this initiative for about 5 weeks now, and we're able to bring it forward. Christina? So, several years ago, with the board and the management team and the workforce, we put together vision and mission statement, and we start our meetings in the health system by reviewing these two statements. So our vision, the communities of Lewis County are the healthiest in New York State and America. So the vision is the big initiative, right? The big goal. Our mission statement, Lewis County Health System is committed to working cooperatively with interested individuals and organizations in helping the people of Lewis County and surrounding communities in achieving their highest level of health and wellness. And what we are doing today brings life to vision and mission by supporting CNAs and LPNs in the delivery of care at our long-term care center. There are several values that guide us, and internally we call it I care. And the 5 values are integrity, compassion, accountability, respect, and excellence. And what we are doing today, announcing today, is bringing our values to life. So, Christina? So, we want to redefine wages for CNAs and LPNs at the RHCFY. For long-term care services to be viable and sustainable, CNAs and LPNs must be recognized differently. And what we are acknowledging is just how hard the work is. It is right up there with one of the most difficult jobs in our health system, and we want to recognize it. In order to do that, we need to think outside of the box. Frankly, traditional approaches to recruiting and retaining are not working. And so we're trying to do it differently. We really want to support progressive actions for a livable wage for those who do some of the most important work in our health system. We recognize that long-term care services in American society are dependent on CNAs and LPN. Frankly, the CNAs and LPNs are the backbone of long-term care in our residential healthcare facility. CNAs and LPNs in long-term care in our organization give up time with their families for the families that we take care of. So it's also important to recognize the current environment. We are in this period of transitioning in the post-pandemic time, okay? And this is important when considering the work of CNAs and LPNs. In addition, they've had to deal with not only the pandemic and the post-pandemic period, but they've also had to live with the hybrid teaching in schools. You know, they have had to navigate their schedules to support hybrid learning of their children. There's limited access to affordable daycare in Lewis County. These individuals are the sandwich generation. Not only are they caring for our residents here, they're caring for their children, their families, and their parents. And they've made a career choice that is very emotionally and physically demanding. In other words, it's really hard work. So why are we doing this at this time? Well, we recognize that for long-term care services to be viable and sustainable, CNAs and LPNs must be recognized differently. I think we went backwards.
No.
We went, it's the wrong slide.
No, it's correct.
Okay.
There we go.
So the work is hard and made harder by the daily responsibilities of life. And this is what we're trying to represent here. So not only do they have an incredibly demanding job, but they have a demanding life. And so we have to think differently as the employer. So as part of that, I want to recognize our team members at the RHCF, hard work and stress of being a CNA and LPN, the fact that they have given up time with their families, and the extra hours they have all worked in meeting the needs of those who call the RHCF home. They have been dedicated, loyal, committed to providing services over this, particularly over this last year and a half. Just want to acknowledge that. We could not do it without these folks. So what's next? We're going to rethink how we recruit new team members and retain current team members. We want to help ensure team members at the RHCF have life-work balance. And there's a way to do this. And the way to do that is to increase the membership on our team with women and men who are compassionate, empathetic, enjoy working with the senior community, are hard workers who have a work ethic, and I'll be quite blunt, that means they come to work, and are team players. If we increase the membership of our team at the RHCF, we will be able to ensure all team members have life-work balance. One way to do this is to increase wages to better align with the work that is required. In addition, we are offering free CNA classes, which will be held in June and July. So, what does it mean, redefining wages for CNAs and LPNs? It looks like this. CNAs will now earn $20 an hour in our organization, and will, based on experience, could earn up to $23 an hour. LPNs, every step on the wage scale will be increased by $2.50. In addition, we have a very progressive health insurance plan, and I would argue is the best health insurance plan in our region. In addition, when a member joins our team, they become eligible for the New York State Retirement Program. So if we increase our team, we can help our members achieve life-work balance. We pay a livable and an incredibly competitive wage and provide benefits that will take them through their working career and support them once they retire. I think we've created, a model that will allow us to rethink how we recruit and retain staff. So that's what we're announcing today. The program for recruiting purposes begins immediately, and the changes in the wage scale will begin on June 28th, which is about 10 days from now, and we're ready to go on this. So with the time that we have left, I'll take any questions you might have.
Jerry, is this program only for the residential healthcare facility, or is it for the hospital side as well with CNAs and LPNs?
Yeah, no, it's this program around the wages is just for the residential healthcare facility, and the market is driving that. Having said that, however, And this is where the partnership with the bargaining unit is important. We have begun the process of negotiating the next contract with the bargaining unit, and our current contract expires at the end of the calendar year. And so over the next several months, Heather and Julie and Brenda will gather with our team and we'll work on the new contract. But this specific initiative today is focused on the nursing home, which is an incredibly important service in our health system, and that piece of the system which is struggling the most with regards to recruiting.
So do you think that this move will be kind of a sign for other facilities as well in the area to try to do better like y'all are doing as well?
It's all I can do to lead this organization. I think the pandemic and the post-pandemic period is causing all of us who work in healthcare to think differently and to really evaluate what are the key services that we should be providing in our HSA health service area. And Lewis County has made a very strong commitment to access to long-term care services. And in order for us to be able to fulfill, that commitment, we need to have the best workforce that we can pull together. We need to have the best team. And I think one of the ways you do that in today's modern America is to think about life-work balance. And if we start thinking about that, then it may cause us to begin addressing other areas so we can really live it. We've had people work from home. Prior to the pandemic, that was not a norm here. So we are thinking differently about that. Flexibility with schedule, particularly when you're looking at, mostly a female workforce that have children to care for and older parents. What can we do more of to better support that? That's not about money, that's about a culture that can embrace and acknowledge that we have working moms. So I think the post-pandemic period will cause all of us to think differently. And let's be totally honest. If we really believe it's one of the hardest jobs in the health system, we have to recognize it as such. And we've had to use agency support, contracted staff, and we don't want to do that because those dollars don't stay local, they leave. And let's take the resources we are spending to provide the service and let's make sure they go to local people who live here, who want to raise their families here, who want to be part of our community. So if this didn't work, then we would have to truly reevaluate if long-term care services could be in our future. We believe this can work. We believe we are really trying to drive a different model, a different way of thinking. And we're optimistic. And it's not like we just woke up yesterday and decided to do this. We've gone back and forth, had spirited discussion, and everyone is committed to the same goal, right? To meet the vision and mission statements, to live the values, to provide the services, and to treat all of our team members with respect.
So I know you kind of brought up recruiting new people, things like that. Obviously not to connect the two, but also the United Helpers in Ogdensburg announcing their closure. Right. Will y'all be trying to recruit some of those individuals that work there, trying to get them to come here because of the experience that they already have?
In some ways, the best answer is yes, but I think there has to be a practical consideration. Where do people live? And if it works and they meet the attributes we spoke of earlier, they're empathetic, they're compassionate, they're hardworking, they show up for work, they're going to be good team members, and they have a passion for caring for the elderly, then absolutely, right? If our senior members are supported appropriately and they're good team members, we welcome anyone who would like to join us.
How does the new compensation structure compare regionally with, like competitively with other organizations?
Based on my review, we would be, the front of the pack at this point. And when I evaluated with our CFO and other members of the team what we are spending in overtime and in contract help, our way of thinking right now is let's use those resources differently. Let's use them to strengthen our team rather than in overtime. Overtime, people enjoy a little of it, but they don't like a lot of it consistently, because that impacts the whole life-work balance. And contract help is not the best approach, and we want to keep jobs local and want local individuals to have access to these resources.
And for folks that would be interested in, you mentioned that there were some free CNA classes coming
Yes.
up in June and July.
Yes.
So would they just go to the LCH.net website and they can find?
And they can just apply that way. That is absolutely correct.
Okay.
And they would do their clinicals here. They're interviewed for jobs here. And so it is a way to bring in new community members. We also think there's going to be a unique opportunity for students in our program. So that individual who is going to nursing school but needs summer employment, so we have a mechanism where they join us for the summer. They work as a CNA, begin experiencing life in healthcare, go to school, come back again next summer during their vacation period, and can earn some meaningful money as they prepare for that next year of college.
And how many open positions would you say you have right now for CNAs and LPNs at the residential
We
healthcare
are
facility?
looking for, our goal with this program is to bring between 25 and 35 individuals on board. And that number is so that we can move away from contracted staff. We can begin growing the number of available CNAs on each unit so we can begin admitting into the RHCF.
Would it be a mixture of part-time and full-time positions, or you mentioned flexibility with work
Correct.
schedules and things like that?
Yeah, there's a definition for part-time, there's a definition for full-time, and there is flexibility.
So I know you said that obviously this didn't happen overnight. So how long have y'all been talking about this and trying to set this in stage to make this actually happen?
We began the initial conversations 5 weeks ago, and just wanted to, how could we do it differently? We've all heard that quote, insanity is just repeating the same thing and getting the same result. Well, in some ways, we reflected on that, and it was just simply, what do we need to do differently? And, there are a lot of unique approaches, around bonus payments and that sort of thing. At the end of the day, we just concluded, let's get out of that part of the compensation program. Let's bring in a livable wage in a very straightforward fashion without a lot of gimmicks. And so that's what we want to transition to. A very competitive wage. It's very transparent, and there's a scale that will reflect. And I think now individuals will be able to appreciate exactly what they earn. And make no mistake, by moving our CNAs to $20 an hour, we're talking about an annual job, an annual salary that'll be over $40,000 a year.
So obviously bringing more money to your employees puts more money into the community. So what do you think this is going to do, not only for the people that are going to receive this, but also the community of Loudonville and Lewis County?
Yeah, well, we're the largest employer in the county, and we contribute $115 million to the local economy. A good amount of that stays here and supports all types of business activity in the county. So it just further supports that not only do we have a healthcare responsibility, but we do play a role in supporting a healthier economy in Lewis County. And, you know, from there, lots of good things happen, right? It becomes a more vibrant community. It's a fun place to be. It's a safe place to be. It's a great place to raise your family. It all builds upon itself. And, you know, between the IDA and the Chamber and the county government of Lewis County, a lot of individuals are really working on the livability in Lewis County, and I think we have a role and a responsibility in that. Okay. All right, well, thank you. If you have some follow-up questions later today, reach out to Christina and she can track me down. Yes, Julie?
Just a quick question. How many CNAs are there currently at the residential care facility?
I would not know that answer off the top of my head, but we can get back to you with that answer.
Okay, thank you.
Yep. Brian, anything from you?
I just got up here.
Okay, so if you have any follow-ups, just reach out to Christina and we'll do our best to answer.
Yeah, I'll catch up with you next week, probably like Tuesday.
Okay, terrific. Thank you. Thank you, Julie, and thank you, gentlemen.